Yes, I am here to introduce Dr. Laurie Leach. She is a neuropsychologist from WakeMed, and she's going to talk to you about how important the health of your brain is to reducing risk for falls. So please give her your attention.
Thank you very much, Christina. We used to be colleagues at WakeMed, so it's nice to see she's doing good for the community. So I'm happy to be here today to talk a little bit just about brain health in general, and I'm going to link it to falls risk as well too, but I don't have the expertise Christina does. My expertise is really just in the brain. A neuropsychologist, as many of you might know, are just clinical psychologists who specialize in working with people that have had injury or changes to the brain. So a lot of my work at WakeMed is just related to people that have had strokes, had brain injuries, but then we work a lot with older adults who just, as the brain ages, start to become concerned about memory loss, development of mild cognitive impairment, about dementia, and I'm going to kind of go over that as well too. But like she said, I do work at WakeMed. And there we do have what we call our pyramid, which is our values and goals as an organization. And I'm sure you can't read this, but what I have circled there in yellow is healthy communities. So that's one of the focuses of WakeMed, is to do everything we can to help make the community healthier. And so this falls, attention to falls risks and falls prevention is certainly part of that. So what I'm going to talk about today is really just about the brain aging. So what happens to the brain as it ages, give you some tips for trying to keep your brain healthy. Going to talk a little bit about brain health factors that may increase your risks of falls, talk a little bit about brain injury and falls, and then ways to really reduce your risk of fall, and then promote healthy brain aging as well too. So what happens to the brain as we age? What do you guys notice the most as you get older? Forgetful, right. Yep. Most people, as we get a little bit older, we notice that we struggle with memory. That's probably the number one thing. And then finding words, you know, that tip of the tongue phenomenon where you're thinking of a name, but it just won't quite come to you. Why is that? Well, the brain ages like everything else. And some of the changes that we see is that the brain shrinks. It just gets a little bit smaller as we get older. It's especially noted in the prefrontal cortex, which is in the front part of the brain, and the hippocampus, which is a structure deep in the brain that's really responsible for memory. So those structures are shrinking a little bit and then have an impact on your thinking skills. There's also slowed and reduced communications between neurons or brain cells in the brain. So it used to be that messages could get transmitted very quickly from one cell to the next. All of that slows down a little bit. And so most people, your thinking doesn't feel quite as quick and sharp as it did before, slower to retrieve information. Blood flow can be reduced in the brain as well too. So oftentimes the little tiny small blood vessels in the brain get clogged up, don't work as efficiently. For any of you that have had brain imaging, sometimes your doctor will tell you that's small vessel disease, meaning that those very tiny small blood vessels just aren't working as well as they used to. It's pretty normal as the brain ages, but can have some conflict or complications for how the brain is working. We also develop plaques and tangles in the brain, which is essentially Alzheimer's pathology. Sometimes that turns into Alzheimer's, sometimes it doesn't, but most of us will have developed some plaques and tangles in the brain. And then we have more inflammation in our brain as well too, which that can be due to a variety of factors. But just as you fall down and hit your knee, you're going to get inflammation around the knee. Just multiple insults to the brain over the year can result in a little bit more inflammation. So on the left side is a CT scan of just what a normal brain looks like at 28 years old, and then this is a normal 78-year-old, meaning that they've not had a brain injury or stroke or anything like that. And it kind of just displays what normal changes look like. You can see here the ventricles are much more larger than they are in a younger brain, and there's a lot more gaps around the edges, which is kind of the shrinkage of the brain as well too. We, in general, tend to be more forgiving of our physical changes as we get older, but most people, we're a little tougher on ourselves when our brain ages and doesn't work as efficiently. But this is some of the reasons why it's not working efficiently. because of those changes in the brain, there are what we call, on your left, normal age-related memory changes. And on the right are things that are probably a little bit more concerning, that you're having more than what's normal aging for your brain. Yes, sir? Mild cognitive impairment. And I'll talk about that in another slide. It's really kind of just when you're having more change in memory or thinking skills than what we'd expect for age, but not to the degree that we would characterize it as a dementia. So the things on the left that are normal, probably most of you could endorse some of those. Usually it just means that you're able to function independently, even though you might still have some occasional memory lapses. You're able to usually recall and talk about times you forgot things. You didn't forget that you forgot, but you remember that you forgot. You may have to pause to remember directions, but you typically don't get lost in familiar places. Occasionally, you may have difficulty finding the right word, might be slower to come to you, but you're still able to kind of hold on to a conversation. And judgment and decision making is the same as it always was. And notice I say the same as it always was, because there's always people who never had good judgment or decision making. So sometimes that's hard as a clinician to know what's what. So when there starts to be concern for it's more than just normal aging, oftentimes people start to have trouble with simple tasks, paying bills, dressing, personal hygiene. Usually can't recall specific instances of what their memory failures were. Usually they have a little bit of a lack of awareness of what their memory problems were. They can get lost and disoriented very easily. More trouble finding the words to the point where it really interferes with their ability to carry on a conversation. And then trouble making choices or judgment or behavior that's kind of out of the norm for that individual. Again, when there's more changes than what we'd expect for age, usually people come for a neuropsychological evaluation, which is the way we sort of objectively measure memory and thinking skills, and then that can lead to a diagnosis of mild cognitive impairment, which means you're having more trouble than what we'd expect for your age, but you're still functioning independently, so we wouldn't call it a dementia. Yes, sir?
First thought is why?
Why do you do that?
Why even figure that out? You can't do anything. You can't improve my brain. Why do
Next slide. Let me go back and then I'll answer that question more fully. But yeah, mild cognitive impairment usually means that you're still functioning independently, but you're having more trouble. The reason that it's important to be diagnosed as MCI is that there are some good treatment options now. Earlier access, earlier identification of MCI can help you work with your healthcare providers. Some of it is just maximizing or optimizing your current medical management. So if you have high blood pressure, you have sleep apnea, making sure that those are all addressed as best we can. But there are also medications that they can give, and the goal of those medications is to minimize progression of difficulties over time, because having mild cognitive impairment increases your risk of developing dementia. So you want to do everything you can as early as possible to make sure that you don't convert to dementia. So you want to modify your risk factors, get on medications, but a lot of it is healthy lifestyle, and I'll get to that in just a minute. That's mild cognitive impairment. And then there's also people then develop dementia as well, which dementia is just a more global term that means change in memory and thinking skills to the degree that it interferes with your ability to function independently. So it's more severe than what we would characterize as mild cognitive impairment. Excuse me. The biggest risk factors for dementia is just age and genetics. So as we age, our risk for dementia unfortunately increases. And then there is a genetic risk to that as well too, though most people don't get tested for the genetic component, but we know there is a piece of that.
Is it my mama's fault or my daddy's fault?
Could be either one or both.
When you say genetic,
Uh-huh.
are you saying that it's inherited?
So There are some forms of dementia that are inherited. Most we don't know exactly what the genetic risk pattern is, but having a family member that has dementia increases your risk of developing dementia.
Does it follow the line of male or female, or?
We don't know for sure. Yeah, don't know. You can get your genes tested to see if you have the genes that increase your risk of developing Alzheimer's. But again, we don't know that for you, if that necessarily will. There's too many factors. It's not genes alone, but whether you're going to then show or develop Alzheimer's, lots of things contribute to that. But like I said, dementia is a more global term, means change in memory and thinking skills, but there are different types of dementia as well. And this is a thing that people confuse a whole lot. Alzheimer's is a type of dementia. It's the one that's the most common and then the most frequent, but there are other types of dementia as well. Lewy body dementia, vascular dementia, frontotemporal dementia, and sometimes it's a mixed etiology, meaning that you have a little bit of Alzheimer's, a little bit of vascular as well too. And then the treatment for dementia is really, again, medications to slow progression of difficulties, but a lot of it is managing your risk factors and risk prevention, meaning doing everything you can from a physical health standpoint to manage it as well. And I put this picture of this Ida Keeling up here. She was 100 years old when she ran I forget the time and the amount, but like a 90-yard dash in like 30 seconds or something like that. And she started training when she was like 95 or 96. So what can you do to promote healthy brain aging is really healthy lifestyle. And so that's why this falls risk and falls prevention is so important, because I hear them reinforcing exercise, exercise, exercise. Exercise helps with risk reduction, but it also helps with brain health in general. Evidence-based research really just points to exercise as being key. It really promotes blood flow to the brain and just keeps the brain healthy. Usually what the CDC recommends is about 30 minutes of a mix of exercise 3 to 5 times a week, but I think most of us encourage you to do something practically every day. And it doesn't have to be super strenuous, it's just getting your body moving, and I'll let these exercise experts talk to that more. It's important as well too, needing to eat a healthy diet. There is a diet called the MIND diet, which is essentially the Mediterranean diet. Research suggests that it has some antioxidant, anti-inflammatory effects for the brain, which can again minimize progression of difficulties over time. Trying to remain active, and that part of that is being mentally engaged, doing activities that challenge your thinking a little bit as well. And then social engagement, because we know that sometimes when people start to have memory problems, have trouble getting around as much, they do tend to withdraw and isolate, and that does tend to increase difficulties over time. Oh darn, this doesn't show up. Yes, please. Thank you. I'm sorry, this is white print. I didn't realize that was going to show up so fast. So it says multiple factors increase falls risks as we age. The focus today, I'm going to talk about sleep, cognitive load, and then brain injury. Thank you so much. Darn it, this shows up really nice on my laptop, but you can't see any of it.
We can still see it.
Okay. Yeah, no, I'm sorry. Okay, so sleep, change, and aging. Sleep is very important for brain health. And what we typically recommend is that you get good 7 hours of sleep a night to promote brain health, because that's restorative. It really helps the brain heal. But there are changes that happen with our sleep as we get older. All of you have probably noticed this as well too. What's the number one thing you notice with your sleep that's different as you've gotten older? Wake up a lot. Yep. Sleep less. Usually it's a shorter duration. You know, when you were 20 or 16 or whatever, you could sleep 12, 14 hours at a time. You've got grandkids probably doing that now, but you can't. So the top one says sleep duration overall tends to get shorter. We have less efficient and more fragmented sleep, meaning that we have more awakenings and increased time spent awake, which is really that waking up and having a hard time go back to sleep. We have different sleep architecture, meaning that we tend to have less REM sleep, which is that time when you're dreaming, and that tends to be less restorative sleep. Our circadian rhythms change, meaning that we tend to have an earlier bedtime and we tend to get up earlier as well too. No staying up till midnight anymore, right? I'm to bed by 9 o'clock and up at 5 a.m. So, and then increased prevalence of sleep disorders as well too. So as you get older, you are higher risk to having some sleep disorders like sleep apnea, things like that.
Would having dreams be a good happening, or would you prefer not to have as many dreams as you have?
I'm not a sleep expert, so I'm not sure on that, but REM sleep is good for the brain, so it's good to have some time that you're sleeping. So that's part of the restorative sleep. Usually as we get older, we have less deep sleep and more light sleep. And so I think, again, that's why it oftentimes doesn't feel restorative. Does anybody have like those smart watches that track your sleep, and you know how it'll tell you how much was deep, how much was light, how much you're awake, how much was REM? That changes as we get older a little bit, and we have less deep, more light, and then some REM. How much REM and you should have, I don't know the answer to that. So it's I don't know the answer to that one either. So I've not read that anywhere, but again, sleep is not my primary focus. So, all right. What was that?
I say most of my exercises I do while I'm dreaming. Without my time.
You've been moving about too much, right? So poor sleep quality is a risk factor for falls as we age. There's been a lot of research that kind of demonstrates when you have poor sleep, you tend to have more falls. Some of it, and Christina's probably talked about this, it impairs your postural control and your balance. So when you're sleep deprived, your balance is not as good, you're going to not have as good a posture as you probably did if you were well rested. It also tends to be linked to slower gait speed, so you're not walking as quickly, and just kind of limiting your mobility or how well you're getting around the home environment as well too. Of course, like I said, having a sleep disorder, you might be on sleep medications can be a factor, make you feel drowsy or things like that. And then both short and long-term durations have been linked to higher fall prevalence. So if you have less than 5 hours, you might have more falls. If you have more than 8 hours, you might have more falls as well too. So again, trying to get into that good window of 7 to 8 hours with good quality of sleep seems to be important. So how do you get good sleep? That's the million-dollar question, and not everything works for everybody. But the best thing is to really have a routine. Going to bed at the same time every night, getting up the same time every day. That really helps you reset your circadian rhythms so that your body knows that it's time to go to sleep, that your body knows that it's time to get up. Having a routine right before bed is important as well too. So getting used to doing the same things right before you go to bed, that helps your brain sort of know it's time to go to sleep. Try to create a sleep-friendly environment. So make sure your bedroom is dark, quiet, and cool. Some people like to use like a noise machine or earplugs to kind of limit noise and things like that. You have to find what works for you. Some people like a sleeping mask. I can't stand that. So find what works for you, but again, a quiet, dark environment. And then using your bed only for sleep and sex is typically recommended as well too. Try not to watch TV in bed. A lot of people like to watch the TV till they fall asleep or things like that. Trying to not read in bed, all those different things, because your brain wants to associate the bed. Watch what you eat and drink right before bedtime as well too. So not having big meals, not having caffeine, try not to have too much alcohol before you go to bed. Most people do tend to have a bedtime drink sometimes, thinking that that's going to kind of relax them, but that can sometimes be more disruptive to sleep. And then just staying active overall. The more exercise that you get during the day, the more active you've been, typically the better sleep that you're going to get as well. Try to manage stress and anxiety as much as you can. So learning strategies for stress management, whether it be deep breathing techniques or meditation. Have you covered that in this, Christina?
Breathing techniques?
Yeah. Yep. So laying in bed, doing some deep breathing, relaxation, all those things can really help you. And then if you do a significant stress and anxiety, certainly working with a therapist to address that can be very helpful as well. You also want to limit naps, try to keep them short. There's no good rule of thumb here, but if you're sleeping more than an hour usually during the day, that's probably going to disrupt your nighttime sleep. You have to, again, see what kind of works for you. If you limit naps or get rid of naps and notice that you're sleeping better at night, that's probably the best thing to do. If you find that just napping for an hour during the day works for you, that works too. And then having exposure to natural light, so trying to get outdoors, get sunlight. Again, that helps to regulate your sleep-wake cycle. And then knowing when to sleep, when to seek help as well. The reason I put that on there is if you do have a sleep disorder like sleep apnea, it's pretty important to use the CPAP machine. That really, again, promotes oxygen to the brain, and not using it can increase your risk of developing strokes or having more cognitive challenges as you age as well. All right, I'm going to switch to a new topic. All right, so we're going to talk a little bit next about falls risks and how it's related to cognitive load. So what is cognitive load? Anybody have guesses here?
How much information you have in your brain, worrying about stuff versus being able to shed things.
Yeah, it's how much work you're putting on your brain at one time. Oftentimes when we're using our brain, we have what's called our working memory, which is sort of, I use the analogy, it's kind of that blackboard in your head. So when information comes in your mind, it comes to you, you're kind of writing it on that blackboard in your head to keep it in your mind. But if you get distracted or somebody gives you more information, then you have to sort of multitask and do two things at once. So you're focusing your attention on multiple things. So, and our brain's ability to really process information simultaneously changes a little bit as we age. So multitasking, trying to do more one thing at once, increases the cognitive load. Having environmental distractions, the TV on in the background, people having a loud conversation, that can increase it because even though you might be paying attention to what's in front of you, your ability to block out that distraction sometimes can be limited, and then your brain's kind of... So we see a decrease in executive functioning, which is a lot of the thinking skills that we use to pay attention and process information, tend to decrease with age, and that results in more cognitive overload deficits. So what is executive functioning? Executive functioning is things like paying attention, and there's lots of different types of attention. There's focused attention, there's divided attention, versions of it. It's also speed of processing, so how quickly you can process information, how quickly you can think flexibly or mentally manipulate information. So it's a pretty complicated thing, and is required for your ability to kind of multitask efficiently is to have good executive functions. Executive functioning does decrease as we get older, which is just a normal part of how the brain ages. And so we don't multitask as easily. We don't have the ability to block out distractions as easily. So our brain can be cognitively overloaded a little bit more quickly. And again, that's going to lead to increased risks of falls as well too. I also wanted to talk a little bit about brain injury and falls, just because, like we've mentioned, falls increase for older adults and can result in a brain injury. I'm sure Christina's hit this point home as well too, because having a brain injury can have a pretty significant impact on anyone's life. So for older adults, falls is the #1 cause of brain injury, especially over the age of 60. And roughly 10% of older adult falls result in a brain injury. So a brain injury can be any type of thing. It can be trauma to the head, falling, hitting your head, down the stairs, hit, anything like that can result. Anything that kind of disrupts the brain's normal functioning. It can result in a variety of symptoms. You can have more trouble with your memory, trouble with your language, trouble with your emotions and behaviors can be a little bit different. The severity can range from relatively mild to pretty severe as well too.
What was the percentage that you just gave?
10% of older adult falls result in a brain injury. Sounds like a small number, but my guess is it's an underestimate as well too. And another point I wanted to drive home too is that you hear a lot of the use of the term concussion, which tends to be treated as no big deal, but a concussion is a brain injury. We often talk, like I said, the severity can be mild, moderate, or severe. A concussion is essentially a mild brain injury, and that term is usually just used when imaging is negative. So if you've injured your brain, you go to the hospital, they take a picture of your brain, it shows some bleeding or bruising on the brain, they're more likely to call that a mild brain injury. If the CT scan doesn't show anything, then they'll likely call it a concussion. It still means that there's been some changes in your brain, but they're really at the neurochemical level rather than bleeding or bruising in the brain. Unfortunately, I see a lot of physicians or other healthcare professionals who use the term concussion to refer to any type of brain injury because I think they think it's more reassuring. Oh, it's just a concussion. It doesn't worry you as much, but it is a brain injury. We do have increased vulnerability to brain injury as we age. So there is a lower threshold for seeking medical attention. You know, with our kids, every time they fell off the swings or the slide and we took them to the hospital, probably wouldn't be worth it. But as we get older, it's important to kind of have a low threshold, particularly if there's a loss of consciousness. That's something that should drive you to go get medical attention, medical care. But why do we have increased brain injuries? Well, there's two kind of reasons from a physiology perspective. One is because the brain has shrunk. There's more space inside the skull. And so if you do have some bleeding in the brain, oftentimes it's going to be a very slow bleed, and you're not going to notice the changes as quickly as the blood kind of fills up. And then sometimes over the course of several days, you'll notice some changes. So there can be kind of a delay in the symptoms they had the fall. There's also just more room inside the brain, so there's more space for the brain to get kind of shook up. So if you fall, because there's more space, your brain's going to hit up against the skull and likely increase the chances that you may have a brain injury. We also know that as the brain gets older, the dura mater, which is the outer, tougher layer of the brain, gets more attached to the skull. And there's bridging veins across the dura mater that are attached to the skull. And they can break more easily because they're so closely adhered. So there's that risk of having epidural hematomas, sorry. epidural hematomas as we age because of those bridging veins are a little bit more fragile and more likely to get damaged in a fall. So again, important if you fall and hit your head, if there is a loss of consciousness or any symptoms, feeling a little dazed, out of it, anything like that, to make sure that you're getting help. All right, we're down to the last couple slides. So what can you do to reduce falls risk and promote brain health? We talked a little bit about sleep. Good sleep is important, so making sure that you're getting at least 7 hours of sleep, and try to pay attention then to the quality of your sleep by developing good sleep routine, good sleep hygiene. Because of issues with cognitive overload, it's important to sit down to do tasks that have a high complexity or require concentration. So again, rather than trying to multitask or stand up while you're doing something, sit down and really kind of take your time to work through that task so that you don't lose your balance, you don't lose your concentration. Try to use lists as much as you can to minimize cognitive load. I hear that story all the time from my patients of, I go to the grocery, I'm only going to get 2 things, and then I get home, and you got 1, right? Making lists just kind of makes it so that you don't have to rely on that cognitive overload, so that you're not at the grocery store thinking about what was it I was going to get, and then you get so kind of internally focused that you may not be paying attention to the environment. You're going to lose your balance more easily, trip over something, things like that. Try to manage the environment as much as you can. Make sure you're limiting distractions. I tell most of my patients that are older, when you're driving, try not to have the music or a lot of conversation while you're driving. For long drives, sometimes that's different when you're on kind of a slow highway, but especially in town or in city, making sure that you're focused on the driving and minimizing distractions around you. Make sure you're paying attention to falls hazards, rugs, pets. I think those have been some of the topics that you guys have covered. And then just being situationally aware in all environments, kind of planning ahead of thinking more about what's coming up in my path. Are there going to be steps? Is there a crack in the sidewalk? Just paying attention to all those different things. Like I said, because of our executive functioning decreasing a little bit as we get older, sometimes we have to be more intentional about planning and organizing sort of what's going to come next. For healthy brain health, again, talked a little bit about exercise, trying to stay mentally active, so engaging in something that challenges your thinking every day. What evidence-based research shows here is that it's not really what you do, but something that has novelty to you. Years ago they used to say, do crossword puzzles. That was sort of the big thing. Nowadays we know it's not any one thing. It's just making something that makes you think, and learning something new in particular tends to engage the brain a little bit more. Stay socially engaged. And then I didn't touch on this one, but floss your teeth. Isn't that a cute picture of the baby? Baby looks like it's flossing his teeth. So yeah, flossing your teeth. There's been more attention to that lately, that some of the periodontal bacteria ends up in the brain. And with Alzheimer's brains, when they look at them after death, they tend to find a lot of periodontal bacteria. Flossing is the only way to get it out. Even if you don't brush, even if you do brush, use mouthwash, not as good as flossing. So, I don't know, that probably does the same, huh? Yeah, but flossing or water pick's important too, so. All right. Water pick, yeah. Yeah, or flossing, either one, so.
Is water pick as good as flossing?
I don't know the answer to that. I would guess so. I mean, it's really just making sure that you're getting the bacteria out between your teeth. I don't know the difference between, no dentists in here, so that can help me. So, all right, well, thank you all for your time and attention. Any questions that you have? Yes, ma'am.
I have one quick one. There's been on the news lately, they're talking about microplastics that they're finding in people's brains. Is that actually a thing?
I haven't read a lot of that research, but yes, I believe it is a thing, definitely. Just like we were surprised about periodontal bacteria in the brain. But yes, I've heard that they find large chunks of plastic. So.
When you say that you can get medication for some of these things if you catch them early enough. What does the medication address?
So,
Can you repeat the question?
sure. The question is, if you do get prescribed a medication because you have mild cognitive impairment or dementia, what does it do? And that's a really good question, because the focus of a lot of research is how can we catch this earlier? Because often by the time that we diagnose somebody as having problems, there's been so much damage that's done already. So the current medications, I don't think I can speak to what the mechanism is, but again, they don't fix or improve anything, but the goal is to minimize progression of difficulties. They're trying to minimize the buildup of amyloid plaques and tangles in the brain. There's some newer medications now that are infusions, that the goal of those medications are to actually remove the plaque from the brain. And that's something that they've only started looking at in the last year and a half. But the focus of research has really been, let's try to catch it earlier before the brain has really damaged and been changed. But I'll be honest, the research is a little bit mixed about the effectiveness of the medications that you take just moving forward. There's some research that says it may not make a big difference. So I think the general clinical advice is, as long as you can tolerate them, it's best to be on them, because it may have more impact than what we're aware of. But what the evidence-based research really shows is it's that healthy lifestyle. Exercise, diet, staying active are just as key as the medications. Yes?
So you mentioned concussions.
Uh-huh.
And how those are a possibility when we fall as we're aging. What are some of the symptoms that we could look for if you have fallen? You're not sure if you have a concussion or not. What might be some of the things that you would notice?
So usually most people will have a sense of feeling kind of dazed. Seeing stars, I think, is the other term that people use. So just feeling a little bit foggy or off in their thinking. Sometimes people can feel like they're struggling more with kind of getting words out, even if it's just momentarily. Sometimes there can be vision changes, so people have double or blurry vision. Sometimes people can feel off balance and things like that. So it's a whole variety of things. A lot of it is because, like we said, concussion is more of a chemical imbalance that's going on in your brain. And when the brain gets kind of shook up from the concussion, it's pulling energy from somewhere to kind of compensate. So it can be more from the motor center, so you notice the balance. It can be more from the vision center, so you notice vision changes. So my advice is, if you're over 60, 65, and you notice any of those symptoms, it's probably good to kind of get it checked out. That answer?
Something to be done about it, right? Like you're on a protocol after you have a concussion. Your activity is changed a bit too, so it is important. So I mean, this is one of my soapboxes. I want everybody that has a fall to consider, even if you haven't hit your head, that you possibly could have done some damage to your brain, and you need to get some attention to it so that you can minimize your risk for falls because of it, right? So it could be anything. The vision is going to impact your risk for falls. The motor control that she just spoke about is going to impact your risk for falls. So might as well go get some medical attention and some advice and some guidelines on how to handle yourself while the brain is healing, because it does need some time to heal after a concussion.
Yeah, usually for concussion, we recommend that for the next 48 hours, you just kind of take it easy. Doesn't mean laying in a dark room. We used to say that years ago, lay in a dark room and do nothing. But we know that's not good for the brain. But usually about the first 48 hours, just take it very easy, do very little, and then gradually start kind of getting back to activities and see how well you tolerate any symptoms that come up. But again, going to the hospital, seeing your primary care doctor, they can guide you into kind of how to manage that and then kind of monitor it closely for you as well too, as you recover. Most people make excellent recovery from a concussion over time, but again, treating it right initially is pretty key as well.
Sometimes people can have a fall as the result of a very mild trans ischemic attack or stroke. And you don't recognise it as such at the time. That's one of the reasons that it's a really good thing to have it checked out, because they can pick up on strokes more readily by simple physical diagnostic things.
Yep, and we see that all the time where people come in and they've fallen, like, we don't know why, and then we realize, okay, they had a stroke, and that's what threw them off. Exactly right. Yep. All right, well, thank you all very much, and pleasure coming to speak with you today. Thank you.